We'll continue with John Hunter's Giant by Jim Stone and Jim Goodrich and George Sobolski, with Jim Stone presenting.
Okay, thanks. We'll try to move along. John Hunter, founder of scientific surgery. His collection, the Hunterian Collection, is at the Royal College of Surgeons in London. Here is the Hunterian Museum in the 1860s. And here we are recently, I think within probably late 90s, Jim, something like that. 86, okay. There's the giants right there. This is Jim Goodrich right there. Hunter, a giant in the natural sciences and medicine, including paleontology, geology, a naturalist, a philosopher who sought to understand life, essentially a thinker rather than a well-read scholar, and was an early evolutionist. He studied embryology, human and comparative anatomy, physiology, disease and repair, pathology, all of which he pioneered and was the foremost British authority on. He performed over 2,000 autopsies early in his career, dissected 500 different animal species. Born and raised in Scotland, never finished school, had a peculiar writing style. Joined his older brother William, who was had an MD degree. He was a physician and an aspiring anatomist, 10 years older than John. Here's the Hunter School. Here's William Hunter, John Hunter, and their nephew, Matthew Bailey, who is called the founder of pathology. Actually, John Hunter was a pathologist. You could call him that as well. He was adept at dissections, preparation of teaching specimens, tireless, full of energy, original observations initially in his brother's school and then his own school. Decided to be a surgeon, followed Cheselden and Percival Pott, and became a surgeon himself. Remained somewhat crude in speech and manner, often swore, argumentative, and befriended the resurrectionists or grave robbers, which was essential if you had to get bodies if you had anatomy schools. And you'll see how this ties in with the giant. He had an experimental farm outside of London. He was all about research. Jenner was one of his students. Why think? Why not try the experiment? His students basically became the next generation of surgical leaders. His lectures, basically he taught through his own, what he knew. He didn't go from what he had read. These were all his own observations, and his pupils carried his teachings far and wide. He became a leading surgeon after Pott died. He was the first to use magnification. This was an eye procedure, and some nerve block analgesia by tourniquet compression, and of course the Hunterian ligation. Now to move towards the giant, he very carefully did an autopsy that included the pituitary fossa routinely, and this comes out of his case books. And here's the example. He described the fossa very carefully, and now to move on to the so-called monsters, which for him included giants and dwarfs. A dwarf with normal mentation, a defect in the nervous influence upon growth. That was his words. He had experience with many male-formed fetuses, spina bifida, anencephaly, conjoined twins, and hermaphrodites. He didn't just have an obsession with collecting, which he did have a big obsession, but he believed monsters in particular were the key to origins and development of life, and every animal possessed an innate propensity to malformation in the embryonic state. Although he thought heredity could be a factor. And the production of monsters to him was clear proof of nature's ability to change. This countered the religious notion that nature was unchangeable, of course. His museum with many examples of ontogeny, recapitulating phylogeny, and of course he's an early believer in evolution. Along comes the giant, For Hunter, any oddity was a prize, and he wanted the cadaver. It included animals, dwarfs. He befriended them and got a hold of their bodies if he could. So Charles Byrne, from Ireland, it's backing up on me, came along. That's the giant, the tall. He arrives in London in spring of 1782 as a tourist attraction. His height's roughly about 8'2", and he becomes sick within a year or so. He becomes sickly, possibly TB, destitute. He was pickpocketed, and Hunter has his man following him, John Howison, who had worked for the Hunter brothers in terms of getting, grave robbers. He was hooked in with the grave robbers, et cetera, et cetera. They followed Byrne until he died. Hunter bribed the undertaker with 500 pounds, which is about 60,000 today. And a plan is formulated. The undertaker inebriates the funeral party on the way to the coast. The giant was very afraid of Hunter, and it was even written up in the newspapers that Hunter was after his body. And friends of the giant agreed to dump the body at sea. So the undertaker, who Hunter had hired and inebriated the party, said, let's lock the body in the so-called secure locked barn. And people were waiting to take the body out, fill it up with paving stones. The body was dumped in the English Channel, and the body was taken to Hunter's house at Earl's Court. This was Hunter's research farm. And at Earl's Court, Hunter, instead of doing his usual autopsy, which included the skull base, he cut it up, he threw it in and boiled it off the soft tissue, and Hunter said nothing about it, told no one about it. He was afraid and that the Irish giant's friends could come after him, and he begins to show it. Here's the copper vat where at Earl's Court where he boiled it off. And 4 years later, Reynolds' painting of Hunter showing the feet of the giants, and shortly afterward it appeared in his museum. Now, gigantism. Pierre Marie described it. By the early 90s, both acromegaly and gigantism appeared to be linked to pituitary tumors. The proposal of a hormone system came along. Cushing, in 1909, firmly proposed that both result from hypersecretion of growth hormone. Cushing emphasized the dominant role of the pituitary in the endocrine system. Let's move to the skull. Investigations on the skull in the 1890s, the anatomist Cunningham believed the skeleton to be acromegalic. He was an anatomist, and reportedly inserted his finger through the foramen magnum to palpate in a large cella. In 1909, Cushing and Arthur Keith, upon Cushing's urging, opened the skull posteriorly. Keith's drawings were published in 1911. Here's Cushing and Keith. And here's what the skull looks like. That's the visor-type opening they made in back. This is unhooked, but here's the other side of the head. And here's the sketch Keith made. And he estimated the cell as 21 AP. There's a big divot or big excavation anterior, anterior to the anterior clinoids is a big excavation. And he estimated it to be about twice normal size and a little bit deeper. This is normals. And that sketch was published in 1911. 1963, the first skull X-rays obtained. And just recently, they kindly took digital photographs for us. And here's the X-ray showing what would appear to be a big cella, of course. And here's the photos. And there's a big excavation anterior to the sella turcical, right here. So, but if you, in these dorsum celli, maybe they're broken, but they seem to be worn down. But I think this whole thing, and this would be more than a, I think it's bigger. I think it's at least 3 centimeters. If each of these is a centimeter, so it looks to be bigger than 3 centimeters. So just another view of the same thing. It looks like that he probably had a homonymous hemianopsia from stretching across his chiasm being stretched. Conclusion: as Cushing concluded 150 years later in regard to the giant, his passion as a collector momentarily exceeded his thirst for knowledge. Had he opened the giant's skull in his customary autopsy, he could scarcely have overlooked the hypertrophic gland or the tumor with its enlarged fossa. Had Hunter done so, the cause of gigantism may have been discovered 100 years earlier in the field of endocrinology seen in earlier birth. Thank you.